right, everybody, I'm back. This is episode 2. Again, Cut to the Chase podcast. I'm Nick Pappas. I'm a board certified orthopedic surgeon. I am on social media doing a lot of educational videos. This is my podcast, which will summarize a lot of the points I typically make on social media. Try to keep it short and sweet. I don't want these episodes to go more than 6 minutes. So we're going to talk about 3 separate topics. We get about 2 minutes each, like a 2-minute drill in football. So stay tuned, and here we go. Topic number 1, supplements in general. All right, so supplements are kind of a hot topic, especially amongst medical doctors. They're not as regulated by the FDA as medications, so you're not exactly sure what you're getting, and sometimes the side effects have not been studied. So doctors in general are hesitant to recommend supplements because you don't generally know what you're getting. And I totally agree with that on many fronts. As a board certified physician, that's my concern as well. That being said, there are some supplements that can be beneficial and that do have studies behind them. So I think it's worth at least entertaining those to some of your patients. And that's why I do discuss supplements, especially if patients bring them up. And the keys to finding quality supplements, if you're going to take them, are number 1, make sure that they are CGMP certified, meaning they're made in laboratories that have current good manufacturing practices certifications, which is generally a third-party certification that ensures that they have in them what they say they have in them and that they're produced in quality laboratories. A lot of times you can get these supplements that are extremely cheap from different countries, and you may not even know exactly what's in the supplement you're taking, and it could have a lot of additives. So if you are going to take supplements, and the supplements are really meant to be an adjunct to a healthy diet. If you could have a perfect diet and you had all the nutrients you needed, you wouldn't necessarily need supplements. But sometimes in certain cases, you may have an issue, like thin bone, or you need to help improve muscle growth. You may need a supplement to help you with that. And that's when they can be helpful. But again, you got to do your research, make sure you're getting it from a high quality CGMP certified facility. That's time. All right, second topic. We're going to pivot a little bit now, talk about something slightly random relative to supplements, and that's blueberries. Now, if you've seen my social media, I talk a fair amount about blueberries. I like simple things, and I like to take the best of that simple thing and use it on a regular basis if possible. And of all the fruits and berries and common vegetables and all that stuff out there, believe it or not, blueberries have the most antioxidants of any of them. And there was a study that showed that several years ago. So by having the most antioxidants, it potentially also has good anti-inflammatory properties, which I would like as an orthopedic surgeon, or just as a person in general, to keep inflammation as low in my body as possible. So I actually eat a handful of blueberries every morning. Blueberries have even been shown to help reduce the symptoms of osteoarthritis in a study. So there is research backing it, and I do favor blueberries. In terms of other little snacks, I think walnuts are a good snack, and the other snack I do appreciate at night especially is dark chocolate. It has to be 70% or greater cacao, but dark chocolate does have flavonols in them, which can also help reduce inflammation. So those are my 3: blueberries, walnuts, and dark chocolate, and that's time. All right, completely shifting gears, let's talk about topical pain medications, which is something as an orthopedic surgeon I get asked about all day long. So of all the topical pain medications I get asked about, the number 1 is Voltaren gel, which is diclofenac. Number 2, I get asked about topical CBD, cannabidiol. I also get asked about BioFreeze, which is menthol, and lidocaine patches. Those by far are the most common ones I get asked about. And this is my spiel on those. In terms of the most research, that's going to be your Voltaren gel and diclofenac. There are plenty of studies showing that it can help reduce inflammation and reduce the symptoms of arthritis. You apply it daily. Sometimes they recommend 2 to 3 times a day. Most people put it on at night and in the morning, and it can help your symptoms dissipate. BioFreeze, which is basically menthol, cools your skin. It kind of distracts you from the pain. It may help a little bit with inflammation, but it doesn't necessarily serve as a long-lasting reliever. It's more for temporary. Lidocaine patches are similar. Lidocaine works by blocking sodium channels, and it's temporary. So the lidocaine patches and the BioFreeze are good for kind of a temporary relief. But In terms of long-acting, there's Voltaren gel and there's topical CBD. Now here's my spiel on topical CBD. Topical CBD is not as studied as Voltaren gel. However, there was a study recently in the journal Hand Surgery that came out in 2022 that was a randomized controlled trial that did show that a topical CBD with 6.2 milligrams per ml concentration mixed with shea butter can reduce your pain from arthritis by about 60% after 2 weeks. Now, there weren't a ton of patients in this study. I think it was 18 total, but it was promising. There were no adverse events, okay? And there's some other studies here and there that are coming out that show the benefits of CBD. The question is the concentration and the overall quality in the mixture. So I have tried using the same mixture as in the study with the 6.2 milligrams per ml CBD mixed with shea butter, and I've seen very good results, okay? That has led me to more often discuss and even recommend CBD topically to my patients. But the most tried and true is still Voltaren gel. Ultimately, there's going to be a comparative study between the two that shows which one works best with the fewest side effects, because topical diclofenac or Voltaren gel does have some of the side effects of typical NSAIDs or non-steroidal anti-inflammatory drugs. So that's my spiel, and that's time. All right, that concludes episode number 2. Hope you enjoyed it, and stay tuned for the next one.